Hello everybody, so this is going to be our third video of the series of Ophthalmology, OSPE and Viva. And I hope you remember our trick that was to define the picture instead of telling the diagnosis. So let's define this picture together, okay? So I can see that there is diffuse erythema of lid margin. You can see over here, there is diffuse erythema of the lid margin. And with that, I can see this red thing over here, which is bulging out from the palpebral conjunctiva. This is conjunctival chemosis, specifically of your palpebral conjunctiva. Chemosis is simply the swelling of the conjunctiva, okay? The edema of the conjunctiva, we call this as chemosis, okay? Whereas bulbar conjunctiva is okay, but I can see some kind of redness over here and over here as well. So, but this disease is affecting palpebral conjunctiva more than bulbar conjunctiva. Then I can see that there is some kind of watery discharge, okay? You can see over here, some kind of watery discharge from the eye, okay? And this is very important, okay? And you can see over here, I can see, then you will say, okay, I can see some crusts over here, that are affecting the whole of the eyelid margin, okay? You can see over here, crust is also present over here, this, okay? So this is affecting eyelid margin diffusely. And the most important thing, this is bleeding ulcer over here. When the crusts are removed, they typically form bleeding ulcer. You can see the bleeding spot over here. And this is due to eruption of this crust. So when you remove these crusts, you find bleeding ulcers. This whole thing is very, very important. Okay, so let's read the text together. Okay, there is diffuse erythema of eyelids, excessive towards margins, okay? Then this point is very important. Conjunctival redness, okay? Bulbar conjunctiva is erythematous, and there is chemosis of palpebral conjunctiva, okay? Then almost whole of the eyelid margin is involved. Crusts formed. Okay, what are crusts? Crusts are derived separations, okay? When they are formed, they are matting the hair together. And on removal of the crust, most probably bleeding ulcer will be formed. And you have already seen it over here. So with all of these findings, your diagnosis will be ulcerative blephritis, okay? Ulcerative blephritis. But to be on a safe side, you will say this can also be conjunctivitis. But because of these bleeding ulcers, my first diagnosis is ulcerative blephritis, okay? So what are your differential diagnoses? Ulcerative blephritis, which is infective anterior blephritis. You have bacterial conjunctivitis. So what is the etiology of ulcerative blephritis? It is acute and chronic infection of lash follicles and associated glands of Zeiss and more. So how to differentiate this thing with this thing from STI? STI is also acute. STI is actually acute infection of lash follicles and associated glands of Zeiss and more. But STI is affecting only one or two of the lash follicles. But here, almost whole of the eyelid margin and associated follicles are affected. In STI, you have only one or two of the lash follicles affected, and then you see nodular lesion which contains mucopurulent fluid and all of the things that we have already discussed in our previous video. Okay, so this is the infection that is affecting your almost all of the lash follicles, and this is typically also by Staphylococcus aureus, but this also has another associated organism known as Staphylococcus epidermidis. What are the treatment options we have? We have conservative treatment option. We ask the patient to maintain eyelid hygiene by washing the eyelids with 25% of baby shampoo. This is very important. Okay, so that we are actually trying to remove those crusts, and you have to do it in a very gentle way, because you know that when you remove the crusts, you form bleeding ulcers. So you have to be very gentle, and you have to use 25% of baby shampoo, okay, to remove those crusps and to maintain the eyelid hygiene. Then we have medical treatment, in which we like to provide some antibiotic ointments. Obviously, we have the etiological factors, bacteria, okay? Bacteria are the etiological factors. So we will like to give antibiotic ointments against these bacteria, which is sodium fusidic acid, very important, chloramphenicol, and ciprofloxacin as well. Then topical steroids, fluoromethalone. Okay, why steroids? Why are we prescribing steroids? This is very important, and you need to understand this. Okay, you may ask me, when this disease is involving lash follicles, why conjunctiva has chemosis, why conjunctiva is showing this reaction, because this disease, these organisms are affecting your lash follicles. They are not affecting your conjunctiva. So why conjunctiva has this reaction? Because the exotoxins produced by the organisms, your Staphylococcus aureus and epidermidis, when these organisms produce exotoxins, these exotoxins generate hypersensitivity reaction in your conjunctiva. Okay, exotoxins secreted by these organisms will generate hypersensitivity reaction in your conjunctiva. C for conjunctiva. And you have, obviously, when you have inflammation, you have edema, right? And because of inflammation, your conjunctiva is showing edema, which is known as chemosis, and redness, okay? So this is very, very important. And because you want this hypersensitivity reaction to be stopped, okay? You don't want it to be present in your conjunctiva. You don't want your conjunctiva to show hypersensitivity reaction. So to inhibit this reaction, you will provide some steroids, okay? You will prescribe some steroids to your patient. This is very important. Okay, antibiotic ointment against those bacteria, then weak topical steroids like fluoromethalone against your chemosis, conjunctival chemosis. Then you will provide some artificial tears to maintain tear film. In a whole of this disease, your tear film is being affected, and you have so many problems with cornea, okay? So to prevent all of these complications, you will prescribe artificial tears to maintain your tear film. What are the complications? Complications are very important. Okay, in eyelid you can have trichiasis. Trichiasis is simply the misdirection of your eyelashes toward the globe. Let me show you this. This is the eyeball, okay? And these are your eyelid margins, okay? And on the eyelid margin, your eyelashes are like this, right? But if these eyelashes are misdirected towards the globe, this condition is known as trichiasis. And obviously, by doing so, they are irritating your conjunctiva, your cornea as well. So trichiasis is very important. Then you have madarosis. Madarosis is simply the loss of eyelashes. So the patient will be losing eyelashes. Poliosis is the whitish discoloration of the eyelashes. The eyelashes of the patient will start become white, will start becoming white, okay? Then you have recurrence of stye and chalazion, okay? So obviously stye, because the hair follicles are being affected, the etiology is same. So the patient can also have stye. And why chalazion? You know that you have your eyelid margin, and on eyelid margin you have your hair follicles, okay? And in the hair follicles you have opening of glands of Sisson wall, and just behind the eyelid margin you have the ducts of meibomian gland. When you have crust formation over the eyelid margin, you are actually blocking the ducts of meibomian gland as well. So when the ducts are blocked, the secretions are built up within the meibomian gland parenchyma, and your immune system generates granulomatous inflammation against those accumulated lipid secretions within the gland, meibomian gland actually. And this condition over here is your chalazion. Okay, to have a very detailed description of this disease, you may watch the first video of this series. Okay, so you are actually blocking the ducts of your meibomian gland, and you will have chalazion because of this condition. Then ptosis. Why ptosis? Let's go to the picture again. Okay, so you have the edema of your palpebral conjunctiva, right? And because of this edema, you are actually increasing the weight of your eyelid. And when you increase the weight, obviously then the patient will be unable to keep his or her eyes open, and there is drooping of eyelids. This condition is known as ptosis. And if the ptosis is because of increased weight of the eyelid, this type of ptosis is known as mechanical ptosis. Okay, if the person has chalazion over here, again the weight of the eyelid has been increased and the patient will have ptosis. Again, the ptosis is mechanical ptosis. Okay, so this is the pathology. Okay. In conjunctiva, the patient will have recurrent attacks of acute bacterial conjunctivitis, again because of the hypersensitivity reaction to exotoxin, to bacterial exotoxin. Then you will have mild papillary conjunctivitis due to hypersensitivity reaction to Staph aureus exotoxin. Same thing. Okay. In cornea, you can have toxic punctate keratitis, catarrhal ulcer. Okay. So important. Why we have these corneal complications? There are two reasons for this. Number one, because you are actually disturbing your tear film. Okay, when you disturb tear film, you are just getting towards corneal ulcer. Okay. Number one thing is because you have disruption of your tear film. Okay, and to maintain tear film, you are prescribing artificial tears. And the most important reason is you have trichiasis over here. You have trichiasis, and these eyelashes are rubbing against your cornea. They're irritating your cornea, and they are going to cause corneal ulcer. So this is very important. Oh, and obviously you have tear film instability. Okay, flectanular keratitis is also there. Okay, I'll be explaining all of these terms to you when we'll reach corneal OSP. Okay, so I hope this is understood, and if you have any kind of questions, please write them down in the comment section. I'll answer there. And kindly subscribe to the channel because it motivates me to make more of these videos. And thanks for watching. Best of luck.